This lecture will be on some hard topics, namely Tetralogy of Fallot. Tetralogy just means a set of four related abnormalities occurring together, and in this case the most important abnormality will be something called pulmonary infundibular stenosis. In Tetralogy of Fallot, pulmonary infundibular stenosis is key. Stenosis means narrowing, and here the stenosis results in obstruction of outflow from the right ventricle. Since after the right ventricle the blood next flows to the pulmonary trunk, it should sound sensible that it's called pulmonary infundibular stenosis. In addition to 1. Pulmonary infundibular stenosis, we will also see 2. Hypertrophy of the right ventricle, 3. A hole in the wall separating the left ventricle from the right ventricle. This hole can be called a VSD, which is the initialism for ventricular septal defect. And finally, 4, what we call an overriding aorta, where the position is not quite where it should be to receive just the effort of the left ventricle contracting. So that's the tetralogy. 1. Pulmonary infundibular stenosis, 2. Right ventricular hypertrophy, 3. Ventricular septal defect, and 4. Overriding aorta. Okay, so how do the four parts of the tetralogy of Fallot work together to cause a problem? We can start by announcing what the resulting problem is. It's that blood going through the heart will largely skip the pulmonary circuit and instead go from the right ventricle to the aorta. So it has that much in common with detransposition of the great vessels. We also know that pulmonary infundibular stenosis is item number 1 in the tetralogy. In Latin, infundibulum means funnel, and the malformation here is that the infundibular septum is displaced antero-superiorly. It's, in other words, a little forward and a little high. 1. The pulmonary infundibular stenosis, it makes the right ventricle work hard. 2. The right ventricle is hypertrophic. 3. The VSD offers another way out of the right ventricle. And 4. The aorta is positioned to receive the flow that is coming through the VSD. Now, because the right ventricle is hypertrophic, on chest x-ray we can see a boot-shaped heart. We said that blood going through the heart will largely skip the pulmonary circuit and instead go from the right ventricle to the aorta. Now, why is that problematic? Because if you skip the pulmonary circuit, you won't drop off your carbon dioxide at the alveoli and get new oxygen. So what might that baby look like at those times when it wasn't getting enough oxygen? It might look cyanotic. And what occasions might make the baby or child have more of a problem? Things like exercise, crying, fever. And it's actually due to the right ventricle outflow obstruction getting worse at those times. These episodes when this happens, they're called TET spells. Earlier we mentioned that squatting increases preload. It actually also increases systemic vascular resistance, which we also call afterload. If you think of afterload as what the heart is trying to push against in order to get the blood out, you can think of increased afterload as something that would make it harder for the blood to rush through the heart. And in the case of tetralogy of Fallot, that means the blood has a harder time rushing past the pulmonary circuit. So squatting actually has a very good effect. Increasing afterload makes the blood less likely to rush past the pulmonary circuit, and instead more of it goes into the pulmonary circuit and gets oxygenated. So a child experiencing a TET spell can squat to make things better. Last items, Tetralogy of Fallot is associated with the thymic aplasia syndromes we study in immunodeficiencies, the ones involving 22q11 microdeletion. I think I'm saying that right. 22q11, or is it 22q11? I'm not sure. The two I'm thinking of are velocardiofacial syndrome and DeGeorge. And tetralogy of Fallot is also associated with fetal alcohol syndrome. Okay, let's tie it all up. The four items that comprise the tetralogy of Fallot are 1. Pulmonary infundibular stenosis, denying normal outflow from the right ventricle. 2. Right ventricular hypertrophy. 3. Ventricular septal defect, offering blood leaving the right ventricle another path. And then 4. Overriding aorta, accepting the blood that just came in through the ventricular septal defect. Tetralogy of Fallot is associated with fetal alcohol syndrome, as well as the thymic aplasia syndromes involving a microdeletion from the Q, that is the larger arm of chromosome 22, and subsequent failure to develop the third and fourth pharyngeal pouches. After crying or feeding, or when agitated, a baby with tetralogy of Fallot may turn blue. This is because the right ventricle outflow obstruction, that is the central feature of tetralogy of Fallot, is worse at that moment. Maneuvers like passive leg raise and squatting, either one can relieve this cyanotic spell by increasing the afterload, thus encouraging the blood to take the good route, the oxygenating route, through the lungs. Okay, that's it for this one.